Welcome to Hepatitis Queensland's Hepatitis B webinar series. This is the second of our Hepatitis B webinars. We hope you enjoyed our first webinar in our series. This time we'll be showcasing what might occur when a patient is tested, diagnosed and begins the journey of living with Hepatitis B. Hepatitis Queensland would like to acknowledge the traditional custodians of the land where we filmed this webinar and acknowledge elders past, present and emerging. Nah, come.
Hi, Min.
How are you?
Good, thank you. How are you?
Good to see you. Very well. Come on in. Take a seat.
How are you?
I'm really well. And you?
I'm very well too. Thank you.
Good to hear. TIS National is the translating and interpreting service available for health services to gain access to support for patients whose first language isn't English. It's a very easy service to use and bookings are made simply through the website. I've been working with Na for a while now and I know that she's really happy to proceed without an interpreter. But I would always speak to my patient at the beginning of our consultation about this. So what can I do for you?
Today I would like to ask you something. We planning to holiday to Vietnam.
Oh,
yeah,
how exciting.
For my niece's wedding.
Yes.
And I would like to ask you what vaccination I need to have.
That's very wise and good that you're coming. When are you going now?
Later this year.
Okay, well that's good that you've come early so that we can plan for you and see what you need. Let me just have a little look here at your chart and just look to see what vaccinations you're going to need. So the sort of things we're going to need to look at is malaria and rabies, but also very important for Vietnam, hepatitis B. There's a very high prevalence of people who were born in Vietnam with hepatitis B.
I don't know about that.
Yeah. So do you know if you've been vaccinated?
I'm not sure too.
Well, what we'll do from today is that I'll order you a blood test.
Okay.
And that way we'll know, we'll have a good picture of where you sit within that. So we'll look at, have you been exposed to the hepatitis B virus or do you indeed even have it?
Okay.
Right? And we can tell all of that from a simple blood test. If you do need to be vaccinated, it's very easy. It's just 3 little injections. You would have one on the day that we decide we're going to start it, one a month later, and one 5 months after that.
Okay.
Okay, but we won't worry about that until we know exactly what your status is. Now, the other thing to let you know is that people who live with hepatitis B don't look any different or don't feel any different. So you or some of your family members may even have hepatitis B.
I'm not sure.
Not sure? Do you know anything about the virus itself?
I don't know.
So let me just give you a brief overview of hepatitis B. It's transmitted through blood-to-blood contact.
Okay.
So blood to blood, and also through sexual contact.
Okay.
So often mothers to babies is the transmission route. So that can be through birth if the mother is if she actually has the virus, and then also through early years of life. Well, it's a very manageable and chronic condition. So you don't have to worry about it. But the first thing that we're going to do is find out what your levels are and have you been exposed.
Okay.
So I'd like to do a blood test and we can order that for you. Here's the form. And the other thing I'd like to do is give you these resources to read between now and when you come back to see me with the blood test results. There are many resources available for the community about hepatitis B. It can sometimes be overwhelming finding something that will be helpful for the patient. Hepatitis Queensland has a range of paper-based and electronic resources available, including some animations and short films. Some of the paper-based booklets are available in other languages such as Chinese and Vietnamese. Additionally, there are other services here in Queensland and across Australia who have great resources as well. Easy reading
information
there.
about
yes.
yeah.
It's in your own language, so it'll be easy for you to understand. Hepatitis Queensland has an info line which anyone in the community can utilise to speak to a trained health professional about hepatitis B and hepatitis C. To contact the info line, call 1800 HEP ABC or 1800 437 222. And if you have any questions, you can always call me, but there's also Hepatitis Queensland you can give a call to. They're always ready and available to answer any of your questions.
Okay, I will when I need that.
Okay.
Yeah. Thank you.
So we'll see you in a week's time. Make sure you have plenty of water the day you decide to have your blood test.
Okay, I remember.
All right?
Yeah.
We'll see you then.
Thank you very much.
You're very welcome, Na. Na? Hello.
Hi, Neil.
Good to see you again. The blood test for hepatitis B is often where there's a lot of confusion. There's 3 parts that are looked at to give any patient their result: the surface antigen, the core antibody, and the surface antibody. All sounds a bit confusing, but let me explain. The hepatitis B surface antigen shows whether you have a current infection. So if there's no surface antigen, then there's no infection. Hepatitis B core antibody shows if the patient has ever been exposed to the virus, now or even in the past. The hepatitis B surface antibody shows if the patient has an immunity to the virus, either from being exposed in the past and clearing the virus naturally or from vaccination. Hepatitis Queensland and ASHM provide helpful testing fact sheets. Now in Na's circumstance, she has the hepatitis B surface antigen and the hepatitis B core antibody, but no surface antibody. So she has a current infection. So Na, I do have your test results back from the blood test, okay? And I don't want you to be too concerned, but I do need to let you know that you have the hepatitis B virus in your blood.
I don't understand what that means.
Okay, nothing to be too concerned about, because the good thing is you've come to see me and we can now manage your hepatitis B virus. The main reason we want to be able to look after you is that there is a strong relationship between the virus and looking after your liver here. This is when it becomes inflamed. But what we want to prevent is the liver cancer. Yeah. That's the most important thing. And how we can do that is to manage you now right through your life. We're going to follow you up every 6 months for the rest of your life.
Okay.
And what we'll be doing at that time is we'll be doing the ultrasound. You've had one of those before. So yes, the radiologist will look at your liver and we'll do a blood test and see how the virus is travelling within your body.
So how often I have to see a doctor?
That will be every 6 months from now on.
Okay.
It's the most important thing I want you to remember from today is that your follow-up is going to need to be every 6 months.
Yeah. Thank you.
You understand that?
Yes, I understand. So how about my husband and my children?
That's a very good point.
So they need to have blood test?
Yes, what I'll do is make an appointment for them to come in and see me. And we'll do some blood tests for them. We'll look after you today.
Okay.
So I'll write you a blood test because you're going to need another different type of test.
Okay.
And you're going to need a referral to the liver specialist.
Yeah.
You see him at the hospital, we'll make an appointment for you to see him. The other thing I'd like to look at is, do you drink alcohol now?
No, I don't drink
No.
alcohol.
And in the family, is your husband drinking?
Yes, he drink, but not much.
Not much, okay. And we'll look at your diet, the meals within the family, and also your exercise. Do you go for a walk?
Yeah, I do exercise too.
Yes, that's good. Very important for liver health. The phases of hepatitis B are important when it comes to understanding and deciding if a patient requires treatment. Again, there are some great fact sheets to help explain these complex concepts. There's 4 main phases: the immune tolerant, immune clearance, immune control, and the immune escape phase. These phases aren't linear, and patients may move between these phases over time and may not necessarily move in a straight line. This is why it's very important that Na continues to see her specialist every 6 months and has her regular checkups. There are a couple of phases within the virus, and what will happen is the specialist will decide what phase you are in, and he will know that from the blood tests.
Okay, yeah.
And he will decide when you need treatment. You won't need treatment straight away. The specialist will decide on treatment, and he will prescribe the medication whether you are in the damage phase or the escape phase.
Okay.
You probably have lots of questions in your mind at the moment. Did you read the books that I gave you?
Oh, yeah.
They were clear, you understood?
Very clear for me.
Okay.
I understand anything.
Yes. I've got some more here for you today. Now that we know you have the virus,
Okay.
there is some different information for you to read here. Have a look through these. Again, you can ring me anytime, but don't forget Hepatitis Queensland. Here's their number, and they're always available to you to answer any of your questions. You feel nice and comfortable about all of that?
Yeah, I'm
yes.
okay.
Okay. Like I've said before, it's a very manageable chronic condition, and you've come to see us, and we'll look after you.
Okay.
We'll get all of this sorted before you go to that beautiful wedding.
Thank you very much. I will see you again.
You're welcome. Hello, Na.
Hi, Min.
Good to see you.
How
6
are you?
months.
Yeah,
Yes.
6 months.
Have a little seat. It's been 6 months.
Yeah,
Yeah.
6 months now.
How are things going for the wedding?
Yeah, anything.
Yes.
Good, yeah.
So how are you feeling, Na? Tell me if there's been any changes in the last 6 months since you were here with me.
I'm feeling a little bit tired, but
Yeah.
I don't have any pain in my leg.
That's very good, isn't it? So a little bit tired.
Yeah.
How are you managing that?
When I feel tired, I take a lot of rest, and I drink more water and eat more vegetable, and I cook the good food by myself.
That's really important. The first thing to remember is to listen to your body. So
Okay.
if you're feeling a little bit tired, don't be too concerned that that's a bad sign. It's just the fact that the virus is there, but you're doing all the good things, drinking water, having some exercise, eating good food, not eating deep fried food. So that's very, very pleasing. Very proud of you. Yeah. So let's have a little look at the blood results from your recent test. So I have them here. Now, it's really a lot of numbers and things, but I want you to feel reassured that the results are very good. There's really not a lot of change in the 6 months. So levels are very similar to last time. This one here, these two are your enzymes, and they're just the enzymes that look after the liver and tell me that things are going well, and then your viral load hasn't changed very much at all.
Oh, good news to hear.
Yeah. How are things going with your husband and children?
They very well, and my children, they have a hepatitis vaccination when they little.
Good.
Yeah, and my husband, he will get the last one at the next 2 weeks for vaccine.
That's
yeah.
excellent. That's great, isn't it? So they've been very supportive. Has your husband Is he understanding about the virus?
But sometimes he just worry about I'm cooking, but I call to the Hepatitis Queensland info line and I ask them, and they said that normal, don't worry about that too much. When I cooking, I just careful and don't cut by myself. If an accident happen, I cut. I can bandage that. Yeah.
So again, I reinforce, call them anytime. You can call me or even leave a message for your specialist.
This service very good.
Yes.
I think,
So you mentioned how eating has become a focus for you with regards to eating well. Tell me now about alcohol.
I don't drink alcohol, but I think maybe little.
A little bit for the wedding?
For the wedding.
Yeah.
I know that.
Yes. It's important to remember that the national guidelines are for 2 standard drinks a day with 2 alcohol-free days a week. However, when you have the hepatitis B virus, it's recommended that you only have 1 drink a day. But as you've told me, you're not drinking at all, just on this special occasion. What about any complementary therapy? Do you take any vitamins or?
Now I would like to take the fish oil,
Yes.
but I'm not sure it's good or not good for me.
No, the fish oil is fine. That is, there's lots of complementary therapies that are really quite safe. But again, I'd like you to refer to someone before you actually start taking it. So you can talk to Hepatitis Queensland or give me a call before you'd actually start anything. So we're going to continue you on your 6 monthly visits. Yes. Have the blood test, the ultrasound, and next time you come, you'll be able to tell me all about the wedding. Yes.
Thank you.
Yes.
Thank you for your help.
You're very welcome. Travel safe.
Thank you very much for your help.
My name is Yvonne. Got my diagnosis when I was in my teens. I wanted to give blood for the first time and I got a letter in the mail telling me that I had hepatitis B in my blood. I had no idea what it was and how I could possibly have picked it up because my parents don't seem to have it. A few years later, I felt a strange sensation around the liver area, and that's when I started to learning a little bit about hepatitis B. But I waited too long. When I first started my treatment, very soon I could feel a difference that I really had more energy. When my kids were small, I was very, very tired all the time. And after I was on treatment, all that became a lot easier and I was able to support them through school better. Treatment for hepatitis B is really easy these days. It's really only 1 tablet a day. The treatments are on the PBS and it has practically no side effects at all. Because hepatitis B has virtually no symptoms, a lot of damage can happen without people noticing, and that's why everybody who has a chronic infection needs 6 monthly or yearly checkups. I would tell a person who suspects that they have Hep B not to be scared. Seeking treatment for hepatitis B really involves a blood test. It's always better to know. Don't wait. Just go and have it done now.